Hi guys, welcome back to Meds Made Easy. My name is Tarun Verma with Telfair Specialty Pharmacy. Today, we're going to talk about Esomeprazole, also known as Nexium, also known as the purple pill, right? That's probably how you guys know it. I know it's gone generic, so I don't know if it's fully purple all the time now, but if it's made by the AstraZeneca people, the people that make Nexium, I don't know if they actually make that or not. Whoever makes Nexium, it's usually purple, right? So what is it for? It is used to treat acid reflux, heartburn, any sort of stomach acid issues you may have. How does it work? It works by turning off some of those pumps. So your stomach lining, I don't do a big enough job to get back here, stomach lining is full of pumps that release acid. That's how it works. So most acid reflux medications work by turning those pumps off. So medications like Nexium, Prilosec, Prevacid, they all work the exact same way. They're just cousins of each other, but they do the exact same thing. They turn off those pumps for a very long time. So it's sort of a long-term use med. So if you have heartburn problems right now and you need help right now, this is not what you use for it. You need to use something like Zantac. What's the other name of the other one? I always forget. It's ranitidine. It's Pepcid. There you go. Pepcid, or in more mild situations, you use Tums. Everyone uses Tums for it, right? Gets rid of stomach acid issues really quick, right then and there. But that's not what you use these for. These are called proton pump inhibitors. So they are for long-term treatment or for people who really have really bad acid reflux. How do you take it? It's very, very easy. Let's see here. You take it 1 hour before a meal with a tall glass of water. Depending on what your issues are, doctors will generally dose it 1 to twice a day. Twice a day is for people who have Barrett's or, I'm not going to get into all that fancy jazz. Essentially, if you have really, really, really bad acid issues that it's coming up to the throat and it's burning holes in your throat, that's when you usually take it like twice a day, or if you have really, really bad stomach acid. But more or less, people just take it once a day. You want to take it in the morning before your meal, and it's easy stuff. Here's a list of side effects right here. And beyond that, really, the only things you want to watch out for are like different kinds of GI issues. Belly pain, extra gas, bloating, anything out of the ordinary that's going on down here that is related to the medication, let your doctor know. Because they should be able to interpret it for you, whether it's like something that they need to address and change you onto something, or we kind of just ride it as is. More or less in the population, I've noticed people tolerate it just fine. It's the people who need to take extra doses of it or need to go onto a different medication because this isn't enough. That's usually what we see. So, that's the caveats there. Beyond that, if you have any sort of hepatic impairment, by that I mean liver, you have any liver issues, make sure your doctor knows, because this does go through your liver, so it needs to be dosed accordingly. So make sure your doctor knows. For women that are lactating, this does get excreted into your breast milk, so you want to be able to, I'm sure your doctor already knows. If they don't, make sure your doctor knows so that they can kind of flip you onto something else that you can take that won't come out through your breast milk, because you don't want your babies to have GI meds. That's just not how it works. I'll do a separate video on this because this is something that's just so prevalent in our society. The food that we eat is directly linked to stomach acid issues, unless it's genetic, which, again, a small amount of the population out there is it genetic for, but really it's all about what we eat. If you eat hyperacidic foods, greasy foods, processed foods, all of those increase the amount of acid in your stomach. So maybe I should go back up by just saying, what's the big deal about acid? Acid is what helps break down all of this stuff that we eat, right? So if you eat a super saturated fatty meal, fried chicken. I love fried chicken. Who doesn't love fried chicken? If you eat fried chicken, you need extra acid being produced in your stomach to break all that stuff down, because that stuff is not easy stuff, right? In comparison to, say, something as easy as like maybe a sandwich or a salad or something, you don't need a lot of stomach acid to break that all down, right? But like bigger foods like the fried chicken or barbecue or anything like that requires a lot of stomach acid now. So over time, if you're eating this kind of food again and again and again and again, your body is just in a state of constant overproducing acid. And that kind of starts to compromise your lining. and that's where you start to have issues, stomach issues of all kinds, diarrhea, blood in your stool, etc., etc. So there's a lot of different things that come of it. And so those are the kind of things you want to watch out for. And so dietary modifications are what are crucial, because a lot of people go, I don't want to, because more than likely you're going to be on this for the rest of your life. Almost always, and don't quote me, that's for your doctor, but you're going to be on this for a very long time. Most people come up to me and they go, Tarun, I want to get off of this, man. I don't want to be on a pill for the rest of my life. I get it. I totally get it. So to do that, we have to start with lifestyle modifications. We have to do diet modifications, right? Things like don't eat late meals. That is a huge caveat, huge. Don't eat McDonald's at 9, 10, 11 at night if you're going to go to bed within a few hours. No, because what happens is, if this is you, right? You're standing upright all day long. If you eat a heavy greasy meal, right, all of this giant chunk gets right here. Whenever you lay down, all of it comes back, because again, it's stomach acid, it's liquid, it's all going to flow back. So then that's where you start having issues down in your throat. You have a valve right here between your esophagus and your stomach. That starts to get compromised very quickly. And that's where we start to have issues. So things like that, if you can fix late night meals or eating a lighter dinner, things like that, that's a great start. Also, watching what you eat in terms of what is acidic and what is not. I could put up a giant list for you, but to be honest, it is mind-boggling, and I don't want you to have those stark realizations on my video. Just Google acidic foods, okay? And you will find out what foods out there are acidic. Like, AKA, let me just blow your mind right now. You probably thought it wasn't acidic. Bananas. Crazy acidic. Bad for people with acid reflux issues. Who would have thought, right? It's a banana. Banana's a banana. It's potassium. Who doesn't love potassium, right? But it's not good for people with acid reflux issues. All of my fellow red wine drinkers. Oh, I love a good bottle of Cab, man. But red wine is terrible. Terrible for people with acid reflux issues. It really just spikes it up. And those who have this problem, you know exactly what I'm talking about. You're probably fist bumping me right now. Fist bumping me right now. Which is why you kind of have to start becoming more of a white wine drinker. White wine doesn't exacerbate your acid reflux issues like red wine does. Or beer. Beer is not that bad. Liquor, definitely bad. If you're a Scotch whiskey drinker, ooh, that stuff will really get you. Okay? So that's what I talk about in terms of lifestyle modifications you got to make to your food. Lemons, limes, oranges, all acidic. All acidic. It will add to more acid being produced in your body. Now you're going to say, hey, Baturun, lemons, limes, these aren't over-processed, so how's my body doing it? The reason why foods that are naturally acidic in nature, think about it. Whatever acid you do have in your stomach, you're eating stuff that's more acidic, so now you're making your whole stomach even more acidic than before, right? So which is why when people say, hey, drink milk, it'll calm down your symptoms, that's why milk is a base. This gets into very basic chemistry, acid-base issues. You want to add a base to the acid to neutralize it. So, but if you add acid on acid, now you're increasing acid in your stomach. And it's not because of your cells overproducing, it's because you're putting extra acid in there, right? So anything super oily, greasy, French fries, that's all acidic foods, the oil being processed. So that adds to it. Beyond that, guys, I think that's it. I didn't do the best job as I wanted to explain the whole lifestyle and that modifications. I don't want to get into it. I know I've done so many other videos with the GI stuff too. I say the same thing in every video, but you know what? Just give us a call. I'll sit down with you for about 10-15 minutes. We'll go through all of this stuff together, and that may be the easiest way to kind of go about this, or talk to one of the other pharmacists at the pharmacy. We all know our stuff. So again, thank you guys for tuning in. Please leave comments below. Tell us how we can improve these videos. At the end of the day, these videos are for you guys. It's meant to help you guys. If it's not, we want to know how we can make them better. And as always, if you have any questions, please call your doctor or your local pharmacist for more in-depth information on anything we've discussed in these videos, or call us here at Telfair Specialty Pharmacy. We'd love to talk to you. And guys, we'll see you next time on Meds Made Easy. Bye-bye.